microphone.
Good afternoon, everybody. So we will commence with some opening remarks from the ministers, and then we'll kick to questions. Minister Cara McNeill will commence, followed by Minister Butler, Minister Manon O'Connor and Minister O'Donnell. Minister Cara McNeill.
Right. Thank you, everybody, and you're very welcome here today. The current health budget will grow by €1.5 billion in 2026. This is an increase of 6.2% compared with the budget 2025 allocation. That will fund an increase of 3,300 whole-time equivalents in the workforce in 2026. So that means the budget for the Department of Health will reach €27.4 billion, and that comprises €25.8 billion in current expenditure and over €1.5 billion in capital investment. Our total pay allocation stands at approximately €12 billion, or a total health-funded HSE workforce of 136,606 staff. The significant increase in the health budget for 2026 reflects the scale of demographic change that we're facing, with the over 65 population up 41% since 2014. This growth is driving sustained demand for services, particularly in areas like older person care and demand and cost for new drugs. The trajectory and the sustainability of health budgets means we need to do everything we can to be more efficient to meet our population's needs. And we are making progress in improving our productivity across health, but there remains significant variation in how efficiently different sites and different regions use their resources. That must improve, and leadership, both administrative and clinical, across the HSE need to drive consistency for us all. So our priorities for 2026 are regional equity in access. In 2026, our focus will be to make it easier and faster for people to get the care that they need. Now, we've already seen improvements, but the variation across regions and sites remains too high. In the Midwest region, for example, 98% of patients referred with urgent breast cancer symptoms are seen on time, but in the West and Northwest region, that figure drops to just 39%. In the Southwest region, then, for example, again, 74% of audiology patients are seen within the 52-week target, whereas Dublin's and Midlands region, that figure falls to 48%. That level of variation, just by way of two examples, is not acceptable, and it's not inevitable. And we can do better, and we must do better, and that's a sustained focus in this year. We also then need to focus on timely access in urgent and emergency care, and we will drive real and lasting improvements in urgent and emergency care. Several sites continue to consistently achieve good operational grip, thereby avoiding congestion in their emergency department. I track the hospital figures absolutely every day, and while we identify that Waterford and Tullamore and others have had a consistently good performance, there are many who have improved within 2025, showing that it is very possible to improve. Tala, for example, has had a simply enormous improvement since the new manager, Barbara, took over in July, and patient flow has improved enormously. We do have other examples, but there should be a consistent equity and consistent experience for everybody. On waiting times, we will accelerate access to services on a 7-day-a-week basis. In September, I held a productivity conference bringing together all of the hospital CEOs, the regional executive officers and the clinical leads. Encouraging results are emerging already in some hospitals and regions for both weekend discharges, which reduced the number of people then on trolleys on Mondays, and also increased outpatient appointments on Saturdays and on the evenings. So, for example, in the Mater Hospital, 81% of the consultants are participating in the public-only consultant contract, and the fact that they are being rostered on Saturdays means that we have had a 39% reduction in the average daily 8 a.m. trolley count from January to June 2025 compared with the same period in 2024. In Beaumont Hospital, weekend and extended day rostering of emergency department consultants has led to a 30% reduction in daily trolley numbers, despite a nearly 6% increase in attendances year on year. Our Lady of Lourdes Hospital in Drogheda has introduced weekend operating in 3 of its 7 theatres, including a dedicated trauma theatre for orthopaedics that has significantly enhanced emergency surgical capacity and reduced some delays. In Cavan, for example, the medical assessment unit now operates on Sundays and bank holiday Mondays, helping divert patients away from emergency departments. These are just some examples of where reform is embraced, impact follows, and we really do see that, with shorter waits, faster discharges and better patient outcomes. And we've got now to continue to support and expand those initiatives to ensure consistent delivery across all of the regions. We're also, very focused on waiting times in community settings as well, and there are real challenges for families in accessing our community services. Therapy waiting list data continues to highlight significant regional variation in service delivery, and let me begin with the best performing regions where waiting lists have been successfully reduced. Occupational therapy in HSE West and North West, physiotherapy, the HSE Dublin and North East, Speech and language therapy, again, HSE West and North West. In contrast, regions where improvement is needed and where waiting lists have increased are occupational therapy in HSE South West, physiotherapy in HSE Dublin and Midlands, and speech and language therapy in HSE South West. So the data underscores a critical point. Performance is not uniform, and some regions are clearly delivering better outcomes than others. So it's essential now that resources across all areas are not just adequately provided, but strategically and intelligently deployed. And we have to ensure that our underperforming regions are learning from the best, adopting proven practices, driving improvements to reach standards set by top performers, and reducing the time that children and families wait for these key services is a priority for all of us in 2026. An additional €984 million will be invested in acute and community services, helping us to reduce waiting times and improve access, as well as an important measure of support. Now, that includes a €665 million increase for acute services and a €319 million increase for community services compared to last year's budget. In addition to this funding, we're expanding the workforce by 3,300 additional whole-time equivalent staff, which will be recruited across all of our services, ensuring we have the capacity to deliver better, faster care. In real terms, that additional funding, alongside existing resources, will, I believe, enable us to help cut waiting times across hospitals, community mental health services, deliver 26.7 million home support hours and expand access through 5/7 working, which is a major change available to us just from this year. We'll open over 500 new and replacement beds, complete surgical hubs in 4 regions, and roll out up to 150 new virtual beds to add to the virtual wards that are there in Limerick and in Vincent's. Investment will fund new medicines, digital health tools, and a major workforce boost with over 1,100 extra student places. My colleagues, Minister O'Donnell, Minister Butler, Minister Murnan O'Connor, will give you greater detail on the investments in their own areas. But to truly deliver better outcomes, we have to invest not only in treatment but in prevention, and we do have a strong focus on prevention and early intervention that underpins our approach, including, for example, the rollout of the RSV immunisation programme, increased uptake of screening and vaccination, and really targeted work on smoking, vaping and substance misuse. This year there has been very good uptake in the RSV infant immunisation programme. To date, approximately 88% of new babies have been immunised. That's on maternity sites. The catch-up element of the programme, however, has a national uptake of about 40%, and we do want that to be higher. We will run the essential immunisation programme again in 2026 because it is just so important, and it results in a significant reduction in young babies getting sick and needing to be hospitalised with RSV. And we will strengthen patient safety and system performance tools through safe staffing, digital health tools, improved prescribing, reduced hospital-acquired infections and faster resolution of safety incidents, ensuring care is not just timely but consistent and high quality. In our screening programmes, the uptake of Cervical Check, the National Cervical Cancer Screening Programme, is the 3rd highest in Europe. In combination with HPV vaccination and early treatment, we are on the road to eliminating cervical cancer as a public health challenge. Uptake of the HPV vaccine in 2024 is about 73%, and while it's higher than the EU average, and that's important, we want it to be higher again. We want it to be closer to 90%. And we want to see the level of ambition for our other cancer screening programmes, specifically efforts to increase uptake in and initiatives to offer mammograms to more women for early detection of breast cancer, and in bowel screening, our bowel cancer screening programme should make it easier for people to get screened for bowel cancer at your local pharmacy, and that's part of the new agreement that we've reached with pharmacies in the last number of weeks, which we haven't spoken enough about, but it's an important part of expanding access to care. On medicines, we will invest heavily in access to medicines with substantial growth in medicines expenditure. Now, that exceeded €3 billion last year. I do continue this commitment in 2026 with over €217 million allocated in this budget to add to that €3 billion to meet the continued cost of reimbursed drugs and to provide for the approval of new drugs next year, and that includes €30 million specifically on new drugs to be available, new medicines. On increased capacity, we are opening new beds, the surgical hubs, the digital, virtual, telehealth services. All of these elements are so important in making sure that we are expanding access, using the existing assets that we have and expanding assets in intelligent ways. But examples of real bricks and mortar achievements which improve those services include the new 96-bed block in UHL, which we will open formally next week, the new surgical hub at Mount Carmel, which has, I think, will have a 3,000 patient by the end of this year, and the HSE Health app, which I believe 140,000 people have downloaded so far. But they really are making an impact. For example, the Mount Carmel Surgical Hub in South Dublin has a direct impact on the St James Hospital day case waiting list. For example, between January and July this year, it achieved a reduction in its day case waiting list by 18.4%. There is an 80% reduction in their pain management waiting list in St James's Hospital as a consequence of the surgical hub operating since February. There is a 21% reduction in their waiting list for plastic surgeries. That means an impact on waiting lists, for example, for breast reconstruction for cancer patients. That's what that means. But we will continue to drive it forward. In 2026, we plan to open 172 new acute beds and 324 community beds, alongside the construction of 4 new surgical hubs in Galway, Limerick, Cork and Waterford, and we expect the surgical hub in North Dublin to open at the very end of this year, I hope. In addition, we will expand virtual acute wards across 5 sites, so that will add to the 2 that are running successfully in St Vincent's and Limerick, and the 5 sites will be Galway, Mercy in Cork, St Luke's, Kilkenny, Drogheda and Tullamore, and we anticipate about 40 beds in each of those, so that's a very significant expansion. Cherry Orchard is an example of how integrated care is provided for patients within a virtual ward. We've had 326 patients admitted and cared for in the Cherry Orchard virtual ward. 94% of them avoided an emergency department attendance or a subsequent hospital admission. Each of those investments speeds up how quickly patients can access care. And it also means more beds, whether virtual or otherwise, as appropriate, mean fewer bottlenecks. More surgical hubs mean faster treatment. And more virtual care means patients can be appropriately treated closer to home, which is what Sláinte Care is all about. So we will continue to invest in delivery and construction at pace to meet the demands of a significantly expanding population. The 2026 allocation of over €1.5 billion for capital expenditure in the NDP is a 100 million, a 7% increase over the 2025 allocation. And we are in the process of working with HSE and other stakeholders to develop the capital plan for 2026 for the health sector. A key reform as well was within our workforce, who are already there and working extremely well, but we want to make sure that they're working at the absolute top of their licence. So in 2026 we will continue to expand advanced practice roles, building on progress in recent years. That allows our healthcare professionals to take on greater responsibility to deliver care more efficiently and reduce bottlenecks in our system. But we want our healthcare workforce to be operating at the top of their expertise, the top of their licence. To support this as well, in terms of new places, we're significantly increasing student training places with 1,100 additional places across medicine, general practice, nursing, midwifery, health and social care professions, dentistry and pharmacy between 2025-2026, and all of that investment is about building capacity for our future. But let me be really clear. Investment alone is not the answer. The health budget has essentially doubled since 2014. We have to make sure that we're getting value for that investment. While the level of investment shows our commitment to improve health services, the automatic response must be, what are we doing with what we're spending, and what more can we do with what we're spending already, rather than waiting for examples of different funding allocations to do the different things. There are strong examples of productivity across the health service, but performance at the moment is still too variable, and we can see that through the publicly accessible hospital productivity dashboard, which shows and confirms through their own data differences across sites, and even within individual departments or specialisms within hospitals. For example, Limerick, Connolly and Tallaght stand out nationally for their overall productivity, increasing their composite activity by over 20% between 2019 and 2024. Despite, and I really have to say this, despite the challenges faced in the Limerick Emergency Department, it really is important to recognise the achievements of the staff in the Midwest and Limerick Hospital. They have increased inpatient discharges by 29% since 2019, managing patient flow in a much, much better way. They're also discharging at weekends better than nearly any other hospital, and they've managed to use their workforce in a combined way, both POC consultants and non-POC consultants, in a really genuinely collaborative way that's making a big distance from the hospital. So we've got to learn from the different high performers around the system and see what improvements people are making. In January, I will meet again with the hospital CEOs, regional clinical leads and executive officers on a region-by-region basis this time. And in April, then, I will bring everybody again together to see track their performance and their improvements on the different productivity measurements in particular from that period, September to April, to see how they are doing. We'll do it like exactly we did in September and to continue to drive our engagement on that. And we have to just continuously ask ourselves, are we organising ourselves in the most efficient way? Are we delivering care that really actually truly meets public needs in the best way? And are we using our resources, the resources that we invest anew in this budget, but the resources that we already have invested? Are we using the resources that we have in terms of our people, in terms of time, in terms of facilities? Are we really using them to their full potential? And in that context, from a safety and a productivity perspective, it's a priority for me to reduce the health services' reliance on agency staffing, which is too high. While agency staff have played and continue to play a vital role in delivering essential care, the current level of dependence and the current level of spend is not sustainable, and our goal in 2026 is to significantly reduce that reliance and have a much more stable, permanent workforce. So to support that, I will delegate greater responsibility to the health regions to manage their overall workforce within their allocated budgets. My strong delivery focus for 2026 will be supported by clear accountability for improvements at all levels in the HSE. We are moving together towards a performance-led model, one that relentlessly shows transparency, drives improvement across regions and services, and that really understands comparative performance and how to lift everybody together to the highest standard. With the regional structures now well established, we are at an important pivotal moment. And so this year, we will begin the process of empowering each region, as well as national services and schemes, to invest in ways that reflect the needs of their communities, recognising the variance that has already been there. Regions will now have increased authority to manage their own budgets and resources within clear parameters and to focus spending where it is most needed within their region. It is a really genuine opportunity for change and innovation, efficiency, and just better value and consistency. With that comes more responsibility and becomes more accountability for regional and local managers at the HSE Centre. And the HSE will set ambitious performance targets across all 6 health regions and rigorously oversee delivery. A strengthened performance accountability framework has to support that comparison across regions, helping us see and understand variance and how things are improving. But in addition to broader improvements in access and reducing waiting times across all services, there are some specific clinical areas that really need to improve for patients. While I will be asking the CEO to improve waiting times, there are also specific services that we all know need to be prioritised. So, for example, scoliosis, cancer, endometriosis, and a range of other areas. We have a new cardiovascular strategy. There's a body of work that supports the different schemes as well. But more than anything else, it is essential that the work that we have already done is patient-focused, prioritised as part of the planning service to deliver quicker access, and patients deserve safe, timely, effective and compassionate care, and we have to have a system that delivers on that. I go around and I visit different emergency departments, sometimes in a scheduled way, sometimes in an unscheduled way, and when I'm there, I always have the opportunity to just look around and see who's there, how are they presenting, how are they in a given moment, what's their age profile, how long are they there? I chat to people, I see what experience they have had. I see so many people coming in and getting the correct diagnostic tests and then going home, which is what you should expect from emergency departments. But I look around, I look at the staff, I look at how they are, I look at the busyness of the facility and just try and work out how is the health service meeting the needs of the people who have come there today and the people who are sitting beside them. People meet our health services, we know, at often times of exceptional vulnerability or times of exceptional chaos. It is not the norm to meet your health service, but everybody is going to have to do it. So when we all meet our health service, how has the HSE made that easier? How have we made that softer? How have we made that quicker, more effective to get the good outcomes that we already know are in our system? I do believe that the budget, the increased allocation that I have in budget 2026 helps us to do that. We are setting higher expectations, we are empowering regions, and we will see what the results of those are. We will hold ourselves accountable for those results and the regions as well.
Minister Butler.
Thank you very much. It's